everyone, welcome back to my channel. My name is Imal Melgo, and today we are going to be talking about glaucoma. Right, you heard right, glaucoma. Why? Because from the 7th to the 13th of this month is the World Glaucoma Week. And for some of you who do not know, and will be like, why is she telling us about glaucoma? Who is she to be telling us about glaucoma? Well, I am an optometrist. I have an OD in optometry. And for the weight loss gang, don't worry, the video will be up on Wednesday. The weight loss video will be coming up on Wednesday, making it 1 week from when we started. So that one is still coming up, don't worry. Okay, so glaucoma, I know most of us must have heard about glaucoma. So, but what exactly is glaucoma? I'm going to be telling you what glaucoma is, the types of glaucoma, and the people that at risk of glaucoma. Okay, so first, what is glaucoma? Glaucoma is an eye condition in which the optic nerve is damaged, and that might be leading to blindness. But first, some of you will be like, what is optic nerve? I'm trying to make this video to be as lay as possible, in layman's terms, not too medical, so everyone can follow and understand. Okay, so the optic nerve is that part behind the eyes that transmits information from our eyes to the brain, and then the brain interprets it and brings it back to our eyes for us to be able to sense an image, for us to be able to see that image. Okay, so what happens is when the optic nerve is damaged, the images cannot be transmitted to our brains for interpretation. So what will cause the optic nerve to be damaged? Well, the eye has a normal pressure that is called the intraocular pressure. Everyone has it, just like blood pressure. There's a range, a normal range for the eye pressure. There's a normal range for blood pressure. Okay, so there's no relationship between the both of them, blood pressure and eye pressure, but I'm just trying to give you an example. So the eye pressure maintains the eye's function, and it also maintains the eye's structure. So what happens is when your eye pressure increases, when your eye pressure begins to increase, it begins to impact on the optic nerve. Okay, so that constant impact on the optic nerve begins to damage the optic nerve, and when the optic nerve is damaged, it cannot do its job of transmitting images to the brain for interpretation, and that is when we say someone has glaucoma. And if it is not treated early and it is left without any treatment, that person will, at the end of the day, sadly go blind. So there are two types of glaucoma, right? So first is the chronic glaucoma, is also known as the open angle glaucoma, and the next is the acute glaucoma, also known as closed angle glaucoma. But in this video, I'm just going to be talking about the chronic glaucoma because it is the most common type of glaucoma that we see. But if you want me to make a video on the acute glaucoma, leave a comment below and I will also make a video on that. Okay, so chronic glaucoma. What is chronic glaucoma? In chronic glaucoma, the eye pressure builds up with time and then starts to damage the optic nerve slowly but surely, slowly but surely. So the pressure just increases with time. It might take months, it might take years. And the bad thing about glaucoma is that in those stages, it really does not have any symptom, right? You do not feel any pain, you do not feel anything. But that is why I'll advise everyone, please use this week to go see an eye doctor for an eye examination. Glaucoma, the nickname of glaucoma is sight thief, right? It just comes and steals it. Before you know it, your vision is impaired and there's really nothing we can do about that. So please go see an eye doctor and check out if your pressure or your eye pressure. Okay, so in chronic glaucoma, the pressure builds over time and it damages the optic nerve slowly. Okay, then what are the symptoms of this chronic glaucoma? Like I said, it has the initial stages have no symptom. You just feel normal, but in some people they say they feel headache, but headache can be 1,000 things. Headache can be I talked too much today, headache can be typhoid, headache can be malaria, so we can ignore those. So the only thing, please brothers and sisters, this week is World Glaucoma Week. Use this week to go see an eye doctor. If this video can make one person to go see an eye doctor and save their sight, I will be more than happy. That's what this is all about. Okay, so there are no symptoms. Some people say they feel headache. Okay, and there's also one simple test. Is I'm going to teach you how to do it. It's really easy. You can do that on your own. Just use your left hand to close your left eye and make sure that your right eye can see every field, left, right, up, down. And also use your right hand to close your right eye and make sure that your left eye can see like all the directions, because sometimes it affects just one eye first and we do not notice it because the good eye compensates. Because we are looking with our two eyes, the good eye compensates for the lack of vision or the impairment of vision of the other eye. So when you close one, you can actually know if this one is functioning properly, and when you close the other one, you can actually know if this other eye is functioning perfectly and not just one is compensating the other. Okay, there are also some risk factors for glaucoma. There are some people that are at higher risk of getting glaucoma. Everyone can get it, anyone can get it, but there are some people that at a higher risk of getting it. So the first group of people is the aged people that are older. So glaucoma tends to be more prevalent in people over the age of 65. But in recently, people over the age of 40 are beginning to develop glaucoma. That doesn't mean that if you're less than 40 or less than 65, you won't get it. It does happen in people less than 40, but just that people over the age of 40 are more likely to get it. Also, people of African descent, Black people, our own is even worse. Like ours is more severe and it comes earlier than usual. So please go for an eye examination this week. Just dedicate this week to going to see an eye doctor. Pick up one day. There are so many eye doctors around. Pick up one day and go for that eye examination. It might save your sight. The world is beautiful. You don't want to lose that. Okay, so the third group of people are people that are nearsighted. Okay, who are the nearsighted people? In layman terms, you know those people that do not see things that are far, but it's not all of them. People that have a high, very high degree of nearsightedness. You know those people that their glasses are really thick, that you can see how thick their glasses are. They are at a higher risk of getting glaucoma also. And then the last group of people that are believed to be at a higher risk of getting it is people that have diabetes. So if you already have diabetes, you should please go for eye checkup regularly to make sure that your own eye pressure is on a normal range. Okay, so treatment and cure. Is there a cure for glaucoma? No, sadly. The damage that is done to the optic nerve is irreversible. So nothing can be done about that. So anyone telling you you can go for surgery for chronic glaucoma is not telling you the truth. The doctors can do anything if the optic nerve is already damaged. That part is irreversible. But the good news is if you catch it on time, if you go to your eye doctor and get your eye examination, and you realize that your pressure is increasing or is above the normal range, Your doctor can treat you. Your doctor can give you eye medication to keep your eye pressure on a normal range that won't damage your optic nerve. Okay, and you can have good vision for a very, very long time. You can have good vision for as long as you want. You just maintain your pressure, it doesn't damage your optic nerve, and you're good to go. Okay, so please, brothers and sisters, let's not ignore just, oh, I can see well, go around. Okay, let's not ignore to the stage that the damage that is done is irreversible and we sadly go blind. Okay, like the theme of this year's World Glaucoma is the world is bright, save your sight. Please go see that eye doctor now. Okay, as you're finishing this video, book an appointment, make a time to go this week. All right, so until next time, like I said, if you want another video for the other type of glaucoma, I will make another video for that. Leave a comment below if you want that. And until next time, see you. Subscribe, like, and share this video. It might help someone. Okay, bye bye.